Hello, I would like to introduce you to the video series HCC Coding for Medical Providers. My name is Dr. Sam Breeding. I'm the Chief Medical Officer of Hostum Medical Group. 2 years ago, I was asked to help educate our doctors on the Medicare Advantage programs and also teach them about HCC coding. I put together a series of presentations that turned into a video series that we now use to help educate our doctors. It's been very successful along with our other efforts. We have increased our risk scores by 20% in the past year on our patients. HCC stands for Hierarchical Condition Category. This is a system of risk adjustment used by Medicare Advantage. In this video series, I will talk about the history of risk adjustment. I will also talk about Medicare Advantage and how it differs from regular Medicare. I will also look at how Medicare Advantage gets its funding. As you know, it is a combination of demographics and health status of the patients, and of course it uses the risk adjustment model of HCCs. In this program, I'm using ICD-10 coding because that is what we are all using now. I will look at the characteristics of the CMS HCC model, including the fact that it is prospective in nature. We will also be looking at the different sources for diagnostics and which ones count and which ones don't count. We'll look at how HCCs correlate with multiple chronic diseases and also disease interactions, and of course the demographics involved with this. I will take a few minutes to look at the star rating system. Medicare Advantage programs that score well get bonuses, and this is very important in funding of the plan. We will also talk about the importance of documenting the diagnosis in your patients on a yearly basis. I will take a look at the acceptable facilities and acceptable providers in supplying information to Medicare Advantage programs. I will look at acceptable document sources. For example, intervention and therapeutic imaging reports are acceptable. However, diagnostic radiology reports are not, because the diagnostic radiologist does not have a face-to-face encounter with the patient as a general rule. Also, again, we will cover this very, very closely because it's very important that you have to have evidence of a face-to-face encounter with patients. Because this is the ICD-10 edition, I will do a little primer so that doctors will understand a little bit more about ICD-10 and how that works. I will look at why HCC codes are important and explain the financial parts of HCC scoring and how it affects the funding of the Medicare Advantage program. Importantly, I will take a look at patients. There are 25 different patients in this video series, and I will show how if you have what I call coding dysfunction, your Medicare Advantage program will miss out on thousands and thousands of dollars used to take care of the patients in the program. For example, in this particular patient, with poor coding, there was only $464 per month to take care of the patient, but with proper coding, there was $2,035, a difference of $1,500 a month in funding to take care of these very sick patients. I will explain how Medicare Advantage gets funded and show how this all works out with the pay-for-value pool and how Medicare Advantage, some will charge premium, some will not, and how all that affects the amount of money that we have to take care of these patients. As you know, there are many added ICD-10 codes that map to now 79 HCCs. We will take a look at all these categories, and I will present each of these in a chapter, and we will look at a patient who has all these conditions and review the diagnosis that are HCCs in these particular HCC categories. And finally, I will take a look at the most common coding dysfunctions in HCC, because these are very important in maximizing the amount of reimbursement that you get in the Medicare Advantage plan. I think you will find this will be a very educational program for all the providers in your system. If you're an individual, I think it will help you tremendously in understanding how this works. I would like to encourage you to consider this program. After all, you only have to code one patient correctly to pay for the cost of this program.